This is the second part of my 1.5-year follow-up video. It could be titled, Disease is Not Random. Don't believe an oncologist who tells you that disease is random. Just like the universe, disease is not random. Leave the care of a doctor who points the bone at you, like if he says, you have 4 months to live, and we don't know why people get cancer. It's just random. Find a new doctor. There are risk factors and causative factors for disease. With disease, there are some well-known in the scientific community primary or causative factors, like smoking tobacco and or marijuana increases your risk of getting lung cancer. If you eat a high-fat, high-meat diet, you're increasing your risk of heart disease, cancer, and diabetes. Eat lots of sugar and or artificial sweeteners, and you are increasing your risk of type 2 diabetes and cancer. The cause and effect of consuming marijuana products with THC are established by science. I'm not trying to invalidate the experiences that many of you have had with marijuana products. In fact, if you've had a positive experience with marijuana, it supports the idea that there is a cause and effect for things. You don't just randomly get high. The specific scientifically tested and documented effects of marijuana with THC can be found on the DEA homepage. I'm going to read it to you to help support my view that there is a cause and effect for all diseases. Marijuana. How does it affect the body? Relaxation, disinhibition, increased appetite, sedation, increased sociability, affects memory and learning, difficulty in thinking and problem solving, hallucinations, impaired judgment, reduced coordination, distorted perception, decreased blood pressure, increased heart rate, dizziness, nausea, tachycardia, confusion, anxiety, paranoia, drowsiness, respiratory ailments. Do you really think you should drive a car when you're high? When and if CBD, cannabidiol, which is derived directly from the hemp plant and can be isolated from cannabis plant, is approved and regulated for medical use by the FDA, we could then have certainty about the strength, the dosage, and the purity of CBD. Until FDA approval, I would not touch any CBD. Now continuing with the causation of diseases. Women who are promiscuous or have a promiscuous partner have a higher risk of getting cervical cancer. This is a well-known fact to the medically educated and seems to have gone missing in the general public. The public schools are focusing on the wrong things. What about cancer in your DNA? The highest level evidence shows that your DNA has very little to do with cancer and heart disease. Disease is caused mostly by lifestyle. I'll explain what I mean by lifestyle in a minute. T.Colin Campbell, PhD, author of the book The China Study, said you could turn cancer on with milk proteins and animal proteins and then back off again repeatedly in animals with diet, removing the milk and animal proteins from the diet. He came to this conclusion after doing more than 800 animal studies for more than 30 years. If you have a PhD in nutrition, you can read Dr. Campbell's article, Cancer Prevention and Treatment by Holistic Nutrition, published in the Journal of Nature and Science. Please do read the abstract. Get your smartphone out and take a picture of the link. Read Dr. Campbell's book, The China Study. It makes a powerful argument for veganism and may save your life. It may save the planet too. You can't be serious about ecology or saving the planet when you eat commercially grown meat. Can you imagine a small car with a Save the Planet bumper sticker in a fast food drive-through line. I see it all the time. We live in one of the sickest countries in the world, and we also live in one of the most affluent countries in the world. The American diet is meat and dairy-centric. Most diseases in developed countries are diseases of affluence like cardiac disease, cancer, diabetes, and obesity. Poorer countries don't have access to as much meat. They're forced to eat more vegetables and grains and have a much lower death rate from cancer and heart disease. But I believe that T.Colin Campbell contributed the most to getting this now called lifestyle medicine movement going. Lifestyle medicine is about getting the proper amount of exercise, proper hydration, reducing stress, reducing chronic stress, that is, a plant-based, whole foods diet, and many other things. There is so much epidemiological evidence. When I say epidemiological evidence, I mean dietary epidemiological evidence from so many researchers that it overwhelms the older or more standard science like the Harvard Nurses Study. There are several other doctors and researchers who came before and after T.Colin Campbell who we could give credit to for starting this lifestyle medicine movement. But I believe T.Colin Campbell contributed the most to getting this now called lifestyle medicine movement going. If you go down the dairy aisle of your local grocery store, you will see a plethora of plant-based, non-dairy milk substitutes, sometimes more plant-based than cow milk. It didn't used to be that way when I grew up. People are getting wise to the harmful effects of dairy. I give T.Colin Campbell and many other scientists and researchers credit for changing the landscape of the grocery aisle. And what I'm about to say next will probably blow your mind or make you think that I'm crazy. But I can see a day coming when all cow dairy products will come with a warning, like on cigarettes, something like this: warning, consuming this milk product will contribute to you getting cancer. Demand for dairy is drying up. Dairies are reducing output or drowning in their inventory. T.Colin Campbell's abstract starts out by saying cancer is traditionally considered a genetic disease. It starts with a gene mutation, often caused by environmental carcinogens that are enzymatically activated to metabolites that covalently bond to DNA. If these now damaged carcinogen DNA adducts are not repaired before the cell replicates, they result in a mutation which is inherited by the daughter cells and their subsequent progeny. Still more mutations are added that are thought to advance cellular independence, metastases, and drug resistance, among other characteristics typically observed for advanced cancer. The stages of initiation, promotion, and progression of cancer by mutations infer in irreversibility because back mutations are exceedingly rare. Thus, treatment protocols typically are designed to remove or kill cancer cells by surgery, chemotherapy, immunotherapy, and or radiotherapy. However, empirical evidence has existed to show a fundamentally different option. For example, the promotion of cancer growth and development in laboratory animals is initiated by a powerful mutagen carcinogen that can be repetitively turned on and off by non-mutagenic mechanisms, even completely by modifying the consumption of protein at relevant levels of intake. Similarly, but less substantiated evidence also exists for other nutrients and other cancer types. This suggests that ultimate cancer development is primarily a nutrition responsive disease rather than a genetic disease, with the understanding that nutrition is a comprehensive holistic biological effect that reflects the natural contents of nutrients and related substances in whole, intact food. This perspective sharply contrasts with the contemporary inference that nutrition is the summation of individual nutrients acting independently. The spelling of holism with the W is meant to emphasize the empirical basis for this function. The proposition that holistic nutrition controls and even reverses disease development suggests that cancer may be treated by nutritional intervention. Now, in finishing up this video, I said my intention for creating these videos is to help you not get cancer and to help you, along with your oncology team, recover from cancer if you already have cancer. Lifestyle medicine is the key, along with doing what your oncologist recommends. As I said earlier in this video, I would be dead right now after my diagnosis in January 2019 if I lived as long as the average glioblastoma patient. But I have removed the cause or risk factors for cancer from my life. I believe that I had 3 major risk factors that gave me cancer: dairy, sugar, small business owner stress. Find a board-certified lifestyle medicine physician. Follow their recommendations. I read this somewhere. If you don't have a map, you don't have a chance of getting from one side of a big city to the other. Again, go to a board-certified lifestyle medicine doctor and get your map. I am now completely vegan. Get 30 minutes or more of aerobic exercise about 5 or 6 days a week. Drink 60 or more ounces of water per day. Don't eat any refined sugar. I eat lots of fresh fruits and vegetables and legumes. And I don't have the stress anymore of running a dental practice. I have learned how not to let stress ruin me. And I meditate about 30 minutes a day. My wish for you all is to be well and be happy. Finally, if you see any errors in the content of this video, please somehow let me know. You can send an email to. I would sincerely appreciate the correction. Thank you and goodbye for now.